Originally, I'm from New York. I was born in New York City and grew up in the suburbs, about a half hour north of the city. Went to college in New York City and then to medical school at State University of New York in Buffalo. After medical school, I moved back to New York City for my internship and started my residency there, and then finished out on Long Island at State University of New York at Stony Brook. After residency, I moved to Plano, Texas for a fellowship in arthroscopy. Originally moved here for a one-year fellowship, always thinking I'd go back, but that was 20 years ago and I've been here ever since. My main focus is in arthroscopy and sports medicine. That was what my fellowship was in. That predominantly entails treating knee and shoulder injuries, although I do see other body parts as well. I still do some general orthopedics, joint replacements, and things of that nature, but it's predominantly arthroscopy. My goal in treating patients is to be able to get them back doing what they want to do. Most times when they come to me, it's because they're no longer able to do something that they want. They've had an injury, they have some other issue that's keeping them from being able to kind of live the lifestyle they want to live. And I think my goal is to try and, as best as possible, get them back to it. As far as ages of patients that I treat, I'll treat all ages. We see patients as young as 4 to 5, up until 80s and 90-year-old. So, but with the arthroscopy, it's predominantly the high school and college age athletes up to the kind of weekend warrior types and middle-aged athletes and people kind of like myself who are still trying to, be as active as we can. I grew up as a kid playing hockey and I've always been a big fan of the sport. So I take care of the Allen Americans, which takes up a lot of time during the season. I play adult league hockey and I also have season tickets to the Stars. I live in Frisco with my wife and my daughter. My daughter is in elementary school. Met my wife down here in Texas, although she's actually originally from Canada. We've lived in Frisco for about 9 years now, and in addition to that, have 3 dogs. I think the best part about treating patients, especially in orthopedics, is that we get to deal, for the most part, with finite problems. We can see a problem, fix a problem, hopefully intervene and correct the problem. So that there's really, you start with somebody who can't do something they want to do, and at the end you've been able to restore them hopefully back to doing what they want to do. And I think that's, in a lot of ways, one of the most rewarding things. I think it's also, we're not saving lives, but hopefully we're improving quality of life in orthopedics. And I think the goal is to, what I really enjoy is being able to get somebody back to doing what they want to do.